care.
No, not. But you know how many women died from legal abortions that year? That's same, legal, wonderful, safe, beautiful.
How many?
24. Now, if you look at the percentage of states where abortion was legal and illegal, the craziest thing is that your likelihood of dying from a legal abortion or an illegal abortion was virtually the same.
Michael says 24 for the number of women who died from safe abortion. Now, if you look at the percentage of states where abortion was legal and illegal, the craziest thing is that your likelihood of dying from a legal abortion or an illegal abortion is virtually the same. If the death rate for a procedure is almost identical, and it's only off by a few numbers, we can conclude that the procedure itself is what's killing people, not the legality of the procedure. That was Michael's point.
See, and I've seen different numbers. I've seen that only in the past, I believe it was 2018, only 2 people died from complications from legal abortion.
Oh, well, of course, because the numbers declined dramatically. The way that they got away with pretending that 5,000 women died a year from abortion, other than Dr. Bernard Nathanson admitted that he just made it up when he was running NARAL. But the reason is because decades prior, many more women died from abortions because medical care just had not progressed to that point. But so obviously, since 1973, medical care has progressed even more, so you would expect that number to go down for legal and illegal. The reason I bring it up is because those scare numbers are... I think they're just used as a kind of propaganda. They deceive in that the numbers usually aren't right, and they're dramatically wrong, and because the number for the illegal and the legal were basically the same.
Bronte says that, and I've seen different numbers. I've seen that only in the past, I believe it was 2018, only 2 people died from complications from legal abortion. Michael points out that the reason that is because decades prior, many more women died from abortions because medical care just had not progressed to that point, which is true. If medical care has better rates for things like successful blood transfusions and suturing up wounds, then less people will die from procedures. Michael owns Bronte again because she has not proven that abortion is any less dangerous when it is legal.
So my question for you is, it seems like you consistently want to find ways to minimize the harm that is experienced by pregnant people. You really want to hone in on mortality, right? Because you think that death is the only negative outcome of pregnancy.
No, I never said that. There's a lot of suffering that goes along with pregnancy.
Exactly, and you think that you get to decide that people who become pregnant should just be obligated to endure that suffering, whether or not
yes, if the alternative is killing the baby, then yes.
So even though the fetus that is completely unaware of its own existence and is not even...
A 3-month-old baby is unaware of its own existence.
Right, but people aren't getting
aware
abortions at 3 months, and people who do get abortions at 3 months, it is largely because of medical concerns or because they do not have timely access to medical care.
I mean 3 months out of the womb. I mean a 3-month-old after birth. They're not aware of themselves.
Bronte evades Michael again and accuses him of having no compassion. Michael never said that the pregnant woman should suffer. He said that she would suffer because of the fact that pregnancy is difficult. But then people can help her mitigate that suffering. When Michael says a lot of adults are not even aware of their own existence, it made me laugh because I thought of that time in Matt Walsh's documentary, What is a Woman?
My truth is that you don't exist. Does that mean you no longer exist?
I mean, if that's your truth, sure. I don't. Because
but you do.
Well, I mean, if you're saying that I do, then I do.
Well, but even if I said that you don't, you still do, because we're having this conversation.
I mean, are we?
I think so. I mean, I thought...
That's what you think.
When Matt asks a girl, what if my truth is that you don't exist? And the girl replies with, then I don't exist. Kind of proves Michael's right when he says a lot of adults are not even aware of their own existence.
But they can feel. They can feel pain. They can feel fear. They can feel hope.
Feel pain.
Not at 9 weeks. They cannot.
Not at 9 weeks. It's questionable.
No, it's really not from science, because we understand the neural networks that are required in order for you to perceive pain and feel emotion, and those neural networks are not present at 9 weeks.
Yeah, well, it's questionable because people keep moving the definition. So you could say that a baby at 10 weeks has a beating heart.
Well, it doesn't actually have...
But you say it doesn't actually have a beating heart because it doesn't look totally like a heart.
No, because it doesn't have all of the chambers of your heart. It is not an anatomical heart. It is the electrical cells that are able to have an electrical impulse. And so again, in order, when you use this language, like the heart is beating and it has a beating heart,
you can
that
hear
is emotional.
Bronte's arguments here of the baby can't feel pain, the baby's heart chambers aren't present, are just moot, because now she's saying if someone cannot feel pain or doesn't have a perfect heart, they're less important? Even if they're human? There is a disease called congenital insensitivity to pain and anhidrosis. People with CIPA cannot feel pain because the pain-sensing nerves in these patients are not properly connected in parts of the brain that receive the pain messages. Most of these people don't live past the age of 3 years old. So according to what Bronte is saying, these people are not important? I think the parents of these children would object to that. Plenty of people have heart surgery because of a hole in their heart. Some people have pacemakers because their heart needs help to function because some of the chambers may no longer be there or are weaker than the other chambers. Are these people not important? Bronte's arguments are ridiculous.
The ultrasound.
Actually, that's a simulated heart sound because it is an electrical impulse.
Based on what?
Because your heart sounds, when we listen with a stethoscope, the heart sounds are made from the valves of your heart opening and closing.
Yeah.
That is what creates that heart sound.
Right.
And when you don't have the proper chambers of your heart at that week of gestation,
Right.
many times the sound on the ultrasound machine is a simulated sound. It can pick up the electrical impulses, but it's
Right.
a simulated sound.
The sonogram as a simulated sound propaganda has been running around for a while. I think I first heard it when Stacey Abrams sat on a stage in front of other people and embarrassed herself.
There is no such thing as a heartbeat at 6 weeks. It is a manufactured sound.
By saying, there is no such thing as a heartbeat at 6 weeks. It is a manufactured sound designed to convince people that men have the right to take control of a woman's body. What?
Exactly. It's translating a represented into a representation. So it is true that a baby at 10 weeks gestation is different in a way from a 10-year-old
Undeveloped.
kid. Yeah, right. It's less
Different
developed.
meaning undeveloped, non-sentient,
Yeah, well, it's
non-autonomous.
not undeveloped. It's just less developed.
No, it's undeveloped.
But it's more developed than it was at 9 weeks, right? It's developing.
Sure.
So yes, it's true that it translates that heart impulse into a sound in some cases. But where does the sound come from? The sound is a representation of what is and will further become the baby's heart.
But is not yet
No, it is.
existing anatomical heart.
No, it's anatomical. Yeah.
But it is not existing in the way
It exists.
that you want.
It does. It does. It's both of those things.
It is electrical cells. It is cells that carry an electrical.
Yeah, it's cells proper to a 10-week-old baby that are
Right.
that are different in some way from cells at a 15-week-old baby and a 10-year-old baby and a 25-year-old.
Michael says it's translating a represented into a representation when he's talking about an ultrasound. Here's what Google search says. Ultrasound imaging uses a small transducer, or a probe, to both transmit sound waves into the body and record the waves that echo back. He's right, of course. The ultrasound is translating a sound from inside your body that you wouldn't normally hear into a representation of a sound that you can hear. Bronte is wrong that it's a simulated sound. It's a recording of the sound inside, so the sound is real. Because Bronte cannot dispute that Michael knows how ultrasounds work, she evades him and switches to saying that babies are undeveloped.
And again, I'm going to continue to repeat, even if you want to apply all of the same rights that a living, breathing person has, do you want to give the fetus those same rights? Nobody has the right to use your body against your will. Not a 9-week-old fetus, not a 40-year-old man. It doesn't matter. And so when you want to remove the right for someone to decide what happens to their body, you're arguing that the only people who should have those rights to their body removed are people with uteruses who become purposefully or accidentally pregnant. They are not deserving of basic human rights, and that is what you are trying to say.
Oh, Bronte's mad. She's being civil, at least. I'll give her credit for that. But she's mad that she cannot defend the position that she thinks babies are undeveloped. She's accusing Michael of sexism once again, and repeating herself, conflating science with rights again. It's ironic that Bronte accuses Michael of having no compassion because she has no compassion for babies and thinks they are not deserving of basic human rights.
You were
I
trying to
really
say.
like people with uteruses, so I have no problem with them. But
Right, when you
keep-
get to decide what happens to their body, when they are trying to decide
we
what's
live
best,
in
then you don't
self-government,
really like
so
them
yeah,
so much.
we make all sorts of decisions about how we should live. But you keep going back to rights, which is interesting to me, because I don't think of politics primarily through a lens of rights, but you do. You keep going back to rights, and you say these fundamental rights to do whatever I want with my body in these circumstances or whatever. So, okay, if we're talking about rights, are all rights equal? Or all rights on this, my right to have this pink fruity drink here, is that the same as your right to, I don't know, drive a car or something? No.
I don't believe they're all equal, no.
Okay, all right, so then there are gradations of rights. Some are more important than others. Is there one most important right that you would call it a fundamental right, the fundamental right?
The right to your body and the right to decide what happens to your body.
When Michael asked this question, is there one most important right that you would call a fundamental right? Bronte gives a ridiculous answer of my body, my choice. You have to first be alive to 1, have a body in the first place, and 2, to make choices about what you do in life.
Happens to your body.
There's no right that precedes it?
I mean, it depends. What rights do you think precede that, please?
Well, it would seem to me that the right to your body, the right to do certain things to your body, must necessarily be preceded by the right to life, without which you would not have your body or the ability to do anything at all.
Well, and as I've described, your right to life does not get to supersede or override someone else's right to bodily autonomy.
But I thought,
Michael then says exactly what I thought he would, which is, well, it would seem to me that the right to your body and the right to do certain things to your body must necessarily be preceded by the right to life, without which you would not have your body or the ability to do anything at all. At timestamp 1 hour, 18 minutes, and 54 seconds, you can clearly hear Bronte say, in agreement to Michael.
well, it would seem to me that the right to your body, the right to do certain things to your body, must necessarily be preceded by the right to life, without which you would not have your
At timestamp 1 hour, 18 minutes, 57 seconds, Bronte nods and says, again.
body or the ability to do anything at all.
So
We just
if-
admitted that it did, because I
You
thought we
said
just
that.
agreed. Oh, you didn't
You
agree
said
with
that.
me. Okay.
No.
As they keep talking, Bronte flat out lies and says she didn't agree with Michael. But she did, so Michael owned her again.
Because it seems to me, if we're going to have any rights at all, the right to drink my fruity drink, the right to have a lovely conversation in this kind of black room here, any of these other rights, that all of those rights depend upon the right to life, which is not just one right among many, but it is the fundamental right. And so therefore, if rights are to have any meaning at all, the right to life must supersede all of the other ones.
And I disagree. I think that you have a right to life, but your right to life does not override someone's right to bodily autonomy.
You're saying that, but why is that true?
Because as I've asked you quite a few times now, you cannot describe to me one instance, except motherhood, where it is acceptable for you to use
we
someone's...
agree, motherhood's unique, but I'm just saying, you are saying that the right to do whatever you want with your body supersedes the right to life. It's more fundamental than the right to life. And I explained to you why I think that the right to life is fundamental and more important than all those other rights. And I gave you, maybe you don't like my argument or something, but I think I at least spelled it out in a way that's fairly clear and logical. So what is your argument as to why the right to control your own body is more fundamental than the right to life?
Because I think that if you allow the government to decide that someone else's right to life can override your right to bodily autonomy, that is opening the door for a lot of terrifying things to happen. This is why you have to volunteer to be an organ donor. This is why you have to volunteer to be a blood donor, things like that. If we allowed the government to say that someone else's right to life can supersede your right to your body, that is a pretty terrifying amount of power to give to the government.
Bronte's using fear tactics here. Saying that a baby gets to grow inside his mother is not the same as saying someone else has to be forced into organ or blood donation. When you give someone an organ via organ donation, you no longer have your organ. The pregnant mother is not giving her baby her organs or her blood in such a way that it leaves the mother with no organs or blood. It's not like when the baby's heart becomes fully developed, the mother's heart dies off and disappears. The mother's body is undoubtedly affected by the baby growing. No one is disputing that. But once again, every woman has the choice to decide whether she wants to engage in sex in such a way that would increase or decrease her chances of becoming pregnant. And I am really tired of saying this. Don't want a baby? Don't have unsafe sex. Why is this concept so hard to understand?
To the
No,
government.
but we're speaking about, I mean, you're talking about organ donations, but we're speaking about this unique case, right? Because...
No, we're talking about the use of your body.
Right. But for instance, Bronte, I have kidneys. I don't need both of my kidneys. Maybe I do to filter all these terrible things I put into my body, but I don't really need both of them. I could give them to someone else. But it would be wrong if the government came in and said, Michael, we're taking your kidney now because Bronte needs it. I might give it to you voluntarily, but I certainly wouldn't want someone coming in gunpoint taking my kidney away. That would be wrong, even if you were in dire straits. I wouldn't. I still might give it to you, but I don't want someone taking it from me. And I don't think that I have an obligation to give you my kidney.
Right.
Because my kidney is for filtering my blood. That's what it's for.
Right.
In the same way, a woman's womb is for nurturing a child. That is the telos. That is the purpose of the womb. It serves no other purpose. So I don't think that the analogy that you're making here is apt. I think, once again, it gets back to the unique status of motherhood.
So the same thing can be said for your liver, right? Your liver...
Well, no one wants my liver.
Well, but your liver, the purpose of your liver is to detoxify your blood. It can process alcohol, it can process all kinds of toxins. But if I don't ingest those toxins, then my liver doesn't have to do that job. If I don't choose to harbor a fetus, my uterus doesn't have to harbor that fetus. Just because your body can do something doesn't mean that you should be compelled for it to do something.
In a very rare case of self-awareness, Bronte has just owned herself. She finally halfway grasped the concept that if she doesn't put a baby inside her, she won't have to be pregnant.
If you choose not to have a drink, then your liver is not going to process alcohol. There's no way the alcohol got in there. But if you decide after, I don't know, you had a crazy weekend, you went out here to Nashville, met a nice guy. You would never do this, but I'm saying, women of ill repute would go out and, they meet a guy. He's not so nice. Anyway, the next morning she finds out she's pregnant. Really, 4 weeks later she would find out. But it'd be very fast. But mothers know, And anyway, she finds out she's pregnant. She says, oh, darn, I don't want to be pregnant. And, that baby has no right to be in my womb. Mm-hmm. She has engaged in behavior that would introduce the baby into her womb in the way that if you put the drink down, you will not be introducing alcohol to your liver.
So should we then deny health care to alcoholics because they partook in behaviors that cause them to have liver failure?
Michael points out that Bronte just owned her own self. Bronte doesn't like that fact, so she evades Michael by saying he has no compassion for alcoholics.
Should we deny smokers access to medical care because they partook in in behaviors that damaged their lungs?
No.
No, but you believe
we
that...
shouldn't kill them, though. I don't think we should kill them, or steal their livers or anything like that. Just like
It's
I don't
not
think
equivalent.
I don't think we should go in and kill the baby just because the.
But you are saying that you get to judge someone based off of their behaviors, and because of those behaviors, and because of those behaviors, you believe that they should be denied access to health care in order to address the effects of those behaviors. And not if it's a drinker, not if it's a smoker, but if it's a woman, then sure, now we get to remove the right to her body and the effects of her behavior.
No.
Bronte says, and because of those behaviors, you believe they should be denied access to health care in order to address the effects of those behaviors, and not if it's a drinker, not if it's a smoker, but if it's a woman, then sure, now we get to remove the right to her body and the effects of her behavior. Oh, so now it's a woman, Bronte? What do you have against using inclusive language? Aren't they pregnant people?
No, well, and I guess we're again missing the point. I don't think a mother ever has the right to kill her child in any circumstances. So I'm not suggesting that we single mothers out here or that it'd be very judgmental or anything like that or deny anybody health care. I just don't think that killing a baby is ever health care. I think that's a euphemism.
And that's where
as
you're
you kind
wrong.
of admitted at the top.
No, that's
when
where
we talk
you're
about
wrong.
the distinction between babies and fetuses.
Michael brings up the doublespeak that Bronte is engaging in, meaning her use of health care is different than his. Bronte means for healthcare to include abortion, while Michael means for healthcare not to include abortion. Michael then owns Bronte again when he reminds her that she admitted babies and fetuses are both terms for humans and that healthcare should never involve harming a human.
See, and that's where you're wrong, though, because when we've talked about maternal mortality rates, we've talked about the #1 cause of death for pregnant people is homicide.
Maternal mortality is still very low, by the way.
Right. Do you know the amount of people who have, do you know the difference between maternal mortality and maternal morbidity?
No. Enlighten me.
So morbidity is essentially unforeseen or serious health effects of a medical condition. So maternal morbidity is when someone experiences severe complications of pregnancy and labor.
Because I don't trust a damn thing Bronte says, and also because I always look up things when people say stuff, I'm going to look up the definitions of maternal mortality and maternal morbidity to see if what Bronte says is accurate. Google search says maternal mortality means the annual number of female deaths from any cause related to or aggravated by pregnancy or its management, excluding accidental or incidental causes during pregnancy and childbirth, or within 42 days of an abortion, irrespective of the duration and site of the pregnancy. Okay, so to break that down, it means any pregnant woman who dies at any time during the duration of her pregnancy because her natural pregnancy had complications. This includes ectopic pregnancy, which I think is what it means by irrespective of the site of the pregnancy. So if the fertilized egg is in the uterus or in the fallopian tube, both cases are counted under maternal mortality. Bronte claims maternal mortality includes homicide when she says, see, and that's where you're wrong though, because when we've talked about maternal mortality rates, we've talked about the #1 cause of death for pregnant people is homicide. Bronte's claim is false according to this definition. Homicide does not have anything to do with a natural pregnancy causing complications. The definition says it excludes accidents and incidental causes, which is where homicide would fall. It is an incidental cause. On to maternal morbidity. Maternal morbidity means any health condition attributed to and or aggravated by pregnancy and childbirth that has negative outcomes to the woman's well-being. This would include pre-existing conditions the mother has, such as if she's got heart problems, if she's excessively overweight, or if she has high blood pressure, and if those things make her pregnancy more difficult, that is maternal morbidity. Okay, so to put it simply, maternal morbidity means if the pregnancy is difficult in an unhealthy woman, but she does not die. And maternal mortality means if the woman dies from pregnancy complications, but she was otherwise healthy. So that's what it actually means. So let's see what Bronte says. Bronte says, okay, so morbidity is essentially unforeseen or serious health effects of a medical condition. So maternal morbidity is when someone experiences severe complications. Bronte is telling the truth about maternal morbidity, but lying about maternal mortality.
And I know that you think that 700 to 800 women dying annually from pregnancy is too low for you to care.
Bronte accuses Michael once again of having no compassion for women. Notice how she changes the word there, because a sexist accusation sounds more accurate when you actually use the word woman.
But
we should bring the number down, but we shouldn't kill 850,000 babies to pretend to resolve that.
Michael owns Bronte once again by saying that he doesn't mean that women shouldn't get help when they get pregnant. He just means they shouldn't kill the baby to fix the problem of women having pregnancy complications. I find it interesting that immediately after Michael says, no, we should bring the number down, but we shouldn't kill 850,000 babies to pretend to resolve that. At timestamp 1 hour, 25 minutes, and 13 seconds, Bronte shifts uncomfortably in her chair. She's been relatively still and comfortable this whole time, taking a drink, crossing her legs, playing with her hair. But after Michael says this particular thing, she is visibly uncomfortable. I know she is staunchly pro-choice, but it seems like something Michael said unnerved her.
So 60,000 people every year have serious maternal morbidity, which means there's certain codes that they use, and like insurance codes that they use to determine whether or not you experienced a severe side effect. And some of those codes are having an ICU admission or needing multiple blood transfusions, things like that. And 60,000 women every year are admitted into the ICU or need blood transfusions, what have you.
That's the full definition of a severe comorbidity?
There's, I think,
we're talking about
10
ICU,
different codes.
or are we talking about certain things that are less severe?
It's severe. What
would be some of the other examples?
So it depends, because it can be sepsis, hemorrhage, I think pulmonary embolism. There's multitudes of different complications that can
But we're not
be
talking about
classified.
something like tearing or something like that.
No, that's minor, and that's not included in 60,000. So that's my point, is 60,000 women every year experience severe morbidity, and that's not including the women who just develop things like diabetes or have a perineal tear.
All the things Bronte is listing when she says, so it depends, because it can be sepsis, hemorrhage, I think pulmonary embolism. There's multitudes of different complications that can come about. All these things she's listing are complications of pregnancy, but not maternal morbidity. If you go by the definition I found, which is that any health condition the woman had that is aggravated by her pregnancy, it means the woman had to have had that health condition before she got pregnant. Sepsis is not a health condition. Sepsis is when you have something dying inside you, whether that be like if part of your bowel is dying or a muscle that has died and it is rotting in your body. That is sepsis. Usually you get sepsis if you had surgery or an injury and something gets infected inside your body and goes untreated so long that it starts to die inside you. It's not a pre-existing condition like just being overweight. Hemorrhage is not a health condition. Hemorrhage is a gigantic loss of blood that happens when you get severely injured. People don't just go walking around bleeding all over the place for years. Pulmonary embolism is the only thing Bronte lists that is a health condition that can happen if you have ischemic heart disease. That would be a pre-existing condition that counts as maternal morbidity. Once again, Bronte's telling the truth about some things while lying about other things. This is a leftist tactic to muddy up the waters. I think it's playing dirty because in order to have a debate, both sides need to be telling facts about why their idea is the right idea, not lying to try to confuse their opponent. It is true that pregnancy can be dangerous and there can be many side effects. But to combat those problems, we need to have effective treatments and quick reflexes to be able to save those women who develop these unforeseen side effects.
Oh, well, that's actually a very important point that you bring up of some of these problems that go along with pregnancy, because something that the abortion advocates mention that often is not addressed by the pro-life movement, not that I think it needs to be, but it's interesting nonetheless, is that the United States is not the best when it comes to maternal mortality. We're not the worst, but we're not the best, and there are lots of problems with it. But the reason for that, of course, is not because of any conspiracy among the doctors or misogyny or anything like that, I don't think. I think it probably has more to do with America's disproportionate rates of obesity and heart disease and diabetes. You look especially, it's not as though complications of pregnancy are the same across all demographics. It's largely concentrated in black women. And the reason for that, it would seem to me, is that black women are much more likely to be obese and to have heart problems and to have diabetes and all those things that do factor into pregnancy problems. But that's not again, I don't think any of that is a good argument to kill a bunch of babies every single year. But that seems like a health issue that should be addressed elsewhere, right? Getting people to exercise, put down the cupcake, not be so obese and have a heart.
Many pregnancy complications are unavoidable and unforeseen. And so sure, there are comorbidities that make you more likely.
A lot of them are. But some are not, I agree. But a lot of them are.
But when we live in a country where healthcare is inaccessible and inaffordable to a large majority of Americans, or a large percentage of Americans.
Yeah, that seems like overstating.
Well, it depends on the statistics, and it depends on what you classify as unaffordable and inaccessible. Because, someone can be, living in a rural area and it'd be less accessible. Someone can be in financial situations, affordable. It just depends on your classification. But the thing is, this entire conversation, you are very fetus-centered, where I am very—
Is that what I am?
Yes, where I am very woman-centered.
Oh.
When we are going through these scenarios, you consistently center the fetus, where I consistently center the woman. I want to consider her health, her finances, her mentality, and her body.
Michael says basically what I said, which is that we need to treat the actual problems of the pregnancies and health conditions rather than blaming it on the babies. Bronte gets upset and starts rambling, and then she accuses Michael of caring about babies. How dare he? Then she uses the word woman again when she says, I consistently center the woman. I thought it was pregnant people, Bronte. Where's your inclusive language? Does it bother you to use inclusive language, Bronte?
Do you think that I'm neglecting that?
Yes, because you believe that the only people in our society who shouldn't get to decide what happens to their body
I've told
are people with uteruses.
I don't think that people have an absolute right over their own body.
Exactly, and that's
I don't think
where
anybody does.
Bronte continues to be upset and switches her tactic to accusing Michael of sexism again. Michael says, I've told you, I don't think that people have an absolute right over their own bodies. I don't think anybody does. When he says he doesn't think anybody does, he means men as well. So obviously he's not sexist. He's saying humans, as a whole, do not have the absolute right over our own bodies. Michael owns Bronte because he proves he's not sexist, and that is ridiculous that she keeps bringing that up.
That's where we disagree.
But I know, but you're putting an opinion into my head that
You've said it multiple times.
I haven't.
What you've said is you cannot tell me one scenario in society where someone can use someone's body against their will, but unless that is a
hard
fetus.
labor in a...
I like that Michael stands up for himself when he says, I know, but you're putting an opinion into my head that I don't hold. It's not a debate tactic to put words into the other person's mouth or put opinions into their head. That's a tactic to bully someone and say, ha, you think this, to try to show the audience how bad your opponent is. Michael owns Bronte because he caught that and he didn't let her get away with that.
Is a
hard
fetus.
labor in a prison. That would be one scenario.
Right? Yeah, well, that's in a completely different topic because that is, essentially...
But when you described it and you said, name me a scenario where someone other than a pregnant person has someone growing inside of them using their organs. I say, okay, I can't name any other scenario. You're right. That's unique to motherhood. You're right. It is unique.
No, I didn't say growing inside of them. I said, tell me a scenario where someone can use someone else's body without their consent. And you can't name me a time.
Well, I just told you, hard labor in a prison.
Well, I mean, that is an issue in and of itself. I don't believe we shouldn't, that's not rehabbing someone. Like, that is definitely taking advantage of a broken system.
Well, but there are three purposes to criminal justice. I guess this is a little bit of a pivot here, but it's not just rehabilitation. We could all use a little rehabilitation. People go to prison to get punished.
Yeah, well, it should be rehabilitation, should it not? I mean, this is a pivot, and I just think it's funny that the only other scenario you can bring up is definitely a symptom of a broken system. And so,
no, I don't think that's definitely. I think it's good to punish criminals. I think that's good.
I mean,
why is that bad?
It depends on the crime, but I am
naturally.
Like a bad
crime, like really bad one,
Again, I mean, this is going off into the weeds, but I'm naturally a compassionate person, and I see the best in people, and I believe especially a lot of crime is committed because of circumstances that people find themselves
Bronte,
in. And I think
I don't mean to be this blunt, but I guess I have to be.
Go for it.
You have been sitting here describing how it is good and moral to permit a system to exist that kills 850,000 people who you admit are human beings every single year because of the desires of another person. That has been your position. And I'm not calling you evil because of that. I think you're just extraordinarily confused and misguided. But to say, I'm such a compassionate person as I make it my jihad to permit the killing of 850,000 babies, who I admit are babies every single year, seems to me absurd.
When Michael says, when you described it and you said, give me a scenario where someone other than a mother has someone growing inside of them using their organs, I say, okay, I can't name other scenario. Any other scenario. You're right. And Bronte says, no, I didn't say growing inside of them. I said a scenario where someone can use someone else's body without their consent, and you can't name me a time. It's telling once again that the reason Bronte is on the side she is on is because she does not like the fact of how pregnancy works. Somehow she still fails to understand that every woman has the choice whether she wants to become pregnant, despite owning herself earlier by saying if she doesn't introduce the fetus into her uterus, then she won't have to harbor the fetus. Michael owns Bronte when he says that she claims herself to be compassionate, but yet is on the side of abortion.
See, and this is why I bring up that you are entirely fetus-centered in this conversation, and you completely disregard the trauma experienced by pregnant
acknowledging
people.
it entirely. I've
Right,
said
but
so many times that women suffer in pregnancy.
But you don't feel like it's worth protecting them from. You don't feel
No,
like
I think it's definitely worth protecting them and giving them the best medical care you can. I just don't think it's worth sanctioning the killing of 850,000 babies a year.
Giving people medical care does not minimize or does not get rid of the trauma and suffering of pregnancy. You can have all the medical care in the world available to you, and you still will experience some trauma, some pain, and some suffering throughout your pregnancy.
Yeah, you want to mitigate that. That's
right. But
it's obvious to me that Bronte is failing here with her argument because she keeps pulling the sexist angle despite Michael saying, I don't think anyone has the right to their own body, meaning men as well. So he's not just singling out women. Michael has also said, I know they're suffering in pregnancy, meaning he knows that women need a little help when they're pregnant. And he's never said women aren't allowed to get help when they're pregnant. All Michael is saying is that you don't solve pregnancy suffering by killing the baby because it is immoral to kill a human. Bronte seems to hold this opinion that if something is to be experienced, it has to be perfect. It has to make you feel good, otherwise it's not worth it. I guess that explains her lack of character and original thought, because life experiences that are difficult build character. Not all life experiences are designed to make you feel good, but that's how you become a stronger individual. Once again, I say pregnancy is not mandatory, so any woman who doesn't want to experience it doesn't have to. I've said before, I'm a woman who isn't interested in getting pregnant, and so I don't. I have that choice. I don't understand why Bronte keeps pretending like pregnancy is mandated.
But if you do not consent to that suffering,
so
then
you're just talking about rape, which is a very, very small percentage of abortions every
Oh yeah,
less than
so
1%.
it doesn't matter, right?
No,
it doesn't
it's worth
matter.
it's worth discussing, but that is clearly the exception of the exception of the exception, not the rule.
Consent to sex is not consent to pregnancy.
Oh yes, it is.
No, it is not. It's consent.
is.
It's consent to the
course.
possibility of pregnancy. It's not consent to enduring pregnancy.
Okay, there you go.
As I've said,
But if it's consent to the possibility of pregnancy, then it is consent to pregnancy.
it is not. It is not consent to enduring pregnancy.
I don't even know how to respond to that. How is it not?
Okay.
I mean, you've just said that when you consent to sex, you are acknowledging the possibility of becoming pregnant and consenting to that. So you are consenting to that. If I consent to go to the bar, and I know that if I go to the bar, there's a possibility that I get drunk, and then I know if I get drunk, there's a possibility that I have a hangover the next morning, then when I go out there to that bar with the boys for a rowdy Saturday night, I am consenting to that hangover that I am going to have, that will involve some suffering and maybe teach me some lessons in the morning.
Right.
Right. So I don't see how is that different with pregnancy.
Oh, dear God, help me get through the rest of this video. Oh, Bronte's tactic now is to make herself look stupid, I suppose, which is interesting. She makes the claim that consent to sex is not consent to pregnancy. The only way someone could become pregnant is through having sex. So if you have unsafe sex, your risk of getting pregnant is higher than if you didn't have sex, or if you had safe sex. If you do an activity that leads to a result or the risk of a result, then yes, you absolutely have consented to that result. You can reduce the risk if you want that result to turn out a certain way, but you cannot claim that you didn't consent to it. If you didn't consent to something, you wouldn't need to reduce the risk because you didn't participate in the activity at all. Michael owns Bronte by saying that if he consents to going to the bar, then there's a possibility he'll get drunk and have a hangover. It's not like he would go to the bar and only drink club soda. So if a person consumes alcohol, they're consenting to the alcohol and whatever the alcohol might do to them the next morning. If he didn't want the hangover at all, he wouldn't go to the bar. So if you don't want the baby at all, don't have sex.
Right, I'll explain it to you. Okay. So, because it's not that different. So say that you just didn't have a hangover, because a hangover doesn't necessarily require medical care. Say that you had alcohol poisoning. Yeah. Should you go to the ER and then be turned away because they're like, oh, well, you drank, so you consented to the possibility of alcohol poisoning, and we have restricted your access to medical care because you consented to the possibility of this happening? No,
of course, but again, as we've pointed out, the issue of abortion is not the issue of abortion does not merely concern the mother. It concerns this other person who you've admitted is a human being. So I think a more apt analogy would be if I go out to the bar, right, and I wake up and I've got this headache, and my kid just won't stop crying. You know, this kid, he cries, but I got this throbbing headache, and so I say, I got to kill my kid. I got to kill my kid to shut him up because he's crying too much. And it's really, my body and my head is just throbbing and I'm suffering. And it's just going to make me feel a lot better if I kill my little baby, who, by the way, is exactly as sentient, I'll even go further, conscious, self-aware as the little baby in the womb. Okay?
It's not.
It is, of course it is.
No, it's not.
Of course it is.
It's not.
You haven't asked me how old my kid is.
Interesting. Bronte owns her own self again by saying, right, I'll explain it to you, because it's not that different. After Michael asked her, right, so I don't see how is that different with pregnancy. But then her train derails when she changes the analogy to alcohol poisoning and then accuses Michael of no compassion again because she claims he wants medical care to be denied to someone with alcohol poisoning. Once again, Bronte misses the point of the entire conversation because no one in this conversation has said that pregnant women or alcoholics should not get medical care. Michael's analogy is about a child making a parent suffer, and then the parent deciding to kill the child simply because he wants to. It's exactly what abortion is, killing the baby because the baby is making the mother suffer through pregnancy. Again, he is making the point that it is not moral to kill other humans simply because they made you suffer.